This is an informative video on the temporal bone and all of its content. The temporal bone is best viewed laterally. This bone lies inferiorly to the parietal bones and forms the infralateral region of the skull and parts of the cranial floor. The word temporal and temple derive from the Latin word for time. So thinking about gray hairs and how it represents time passing, gray hairs actually appear on the temporal region first. Each temporal bone has its own intricate shape, and it can be described by using three major parts: the squamous, tympanic, and petrous part. First, the squamous part, which is located right here. From the squamous part, the zygomatic process projects out. This process projects anteriorly and meets with the zygomatic bone of the face. With these two bony structures coming together, it forms a zygomatic arc, also known as a cheekbone. On the underside of the zygomatic process, there is a fossa or depression that forms a joint with the condylar process of the mandible, the lower jawbone, and this forms a freely movable temporomandibular joint. The temporomandibular joint aids humans in chewing, talking, opening our mouths, and even yawning. There is a disorder of the temporomandibular joint, TMD. TMD may occur from a sports injury, a dislocation of the jaw, or even arthritis. This could turn into a chronic disorder, and it affects many people. The pain can be described as a very sharp to dull feeling. People that feel discomfort or a locked jaw should see a doctor or chiropractor to see if it's TMD. Moving on, we look at the tympanic part. The tympanic part is located in this area right here. The tympanic part encases the external acoustic meatus, or the external ear canal. In appearance, the external ear canal is a slightly curved tube. This canal extends inward from the floor of the auricle, or protruding portion of the outer ear, and ends at the eardrum membrane. Through this small canal, sound waves can enter the ear. At the deep end, the external acoustic meatus and the tympanic membrane, or the eardrum, are also parts of the external ear. In a dried-out skull, the membrane is removed, so part of the middle ear cavity deep to the tympanic region may be visible through the meatus. Tympanic part, we move to the petrous part. This rocky-looking part is the petrous part. It contributes to the cranial base, and this forms a bony wedge between the occipital bone posteriorly and the sphenoid bone anteriorly. Looking inside the cranial cavity, the petrous part looks like a part of a mountain. On the posterior slope of the ridge of the mountain lies the posterior cranial fossa. On the anterior slope is the middle cranial fossa. This fossa holds the temporal lobes of the brain. Foramina are holes for passage of arteries, veins, and nerves. Highlighted in yellow, the jugular foramen is located in the petrous portion where it meets the occipital bone. In this foramen, the largest vein of the head, the internal jugular vein, and the cranial nerves 4, 5, and 6 use this foramen as a passageway. Looking at the temporal bone in an inferior view, we have the zygomatic process right here, the styloid process right here, the jugular foramen, and our next topic, the carotid canal. The carotid canal is anterior to the jugular foramen. In the cranial cavity, the internal carotid artery passes through. This artery is the main artery for the brain. Another opening in the petrous part of the temporal bone is the foramen lacerum. Triangular in shape and highlighted in blue, the lacerum looks like a jagged or lacerated opening and is located between the medial tip of the petrous part. In a living human, the lacerum is covered with cartilage, so when the students get a dried-out skull, they have a hard time finding it. So the students tend to ask the professor where the lacerum is on the dried skull, and the professor will show them. The last opening is located in the cranial cavity on the posterior face of the petrous part, and it is called the internal acoustic meatus. This meatus actually houses the vestibulocochlear nerve and the facial nerve. The stylus-looking pointer at the inferior part of the temporal bone is the styloid process. How I remember this is that it looks like a stylus that you use on your mobile phone or tablet. Its function is for articulation to some muscles of the tongue and pharynx. Laterally and posteriorly to the styloid process is the mastoid process, which is breast-shaped. An interesting fact is that you can feel this, and it is the lump just posteriorly to your ear opening. In conclusion, the temporal bone may be small, but it is composed of many regions, foramens, and processes. So with viewing this informative video, I only hope that I aided you with your studying. Thank you.